So hello everyone, my name is Todd Creviston. I'm a benefit educator at Wespath. In about the next 45 minutes or so, we'll review all of the HealthFlex well-being programs. So these are programs that are associated with the HealthFlex insurance plan that you are currently covered by. And what we see here on our first slide, these are kind of the big ticket items, the big names of programs that are available to you. So there's a significant focus on emotional well-being. That program or that component has been added to over time. There's a number of surveys that we do, and it was seen as a need. So we actually added a couple of programs that I'll cover toward the end of this presentation today. Physical activity is also a big piece. You can use Personify Health to track your physical activity and a bunch of other things. There's programs to improve your diet. There's programs to improve your sleep, and also navigating and living with chronic conditions. So really that HealthFlex Wellbeing Program has something for everyone. And previously I'd mentioned the 2 surveillance programs. So we have at the top here, the assess health risks, health status and risks. And we've got 2 programs that do that. And these also provide wonderful feedback back to the individual. So the first one is Blueprint for Wellness. This is a biometric screening. It measures 25 different key health indicators. If we start at the top, it'll measure your thyroid function. It'll measure your cardiac risk through various cholesterol tests, through various inflammation tests. Of course, your blood pressure is included in there. And then pancreas, that's for your blood sugar. There's 2 tests for that. So there's multiple tests. And once you complete Blueprint for Wellness, you will receive a report in the mail called My Guide to Health. That My Guide to Health.
We can see or maybe it's just me. I can see the slide, but it's like a little postage stamp size right above your camera.
Mine's really big.
Oh, okay. It's just me.
Yeah,
Sorry.
mine's big. Mine's big too.
Okay. Operator error. Carry on.
Okay, thank you. So the Blueprint for Wellness is a screening that you complete between January and August. August 31st is the last day to get screened. And then the health check also has a completion from January through August 31st. So if you haven't completed that, you will continue to get notifications, emails from Wespath to encourage you to complete that. The health check is a survey that you complete on Personify Health, and that too measures multiple things, including stress, sleep, your physical activity, and it's all self-report. At the end of that, you'll get a number. The higher the number, the better. And you can actually complete that over time in a year and watch that number change. So for example, you increased your physical activity, maybe you changed your diet a little bit, and then you can go and take that test again or that assessment and watch that number change. You'll need to complete that health check from from January 1st through August 31st. So you need to complete it in that window the first time to get credit for it. Okay. So those 2 are designed to assess risk, and we assess risk anonymously on an aggregate basis. And then the programs to improve or maintain well-being include the big 6 items down at the bottom. The first one is Personify Health. Personify Health is kind of where all of those programs are accessed. So if you're not enrolled in Personify Health, we recommend that be your next best step, because you'll log in and you can log in on your desktop and see all those programs that are available, including health coaching through Personify Health, the employee assistance program. The phone numbers in the search function accessible through that. And then a couple of programs to improve chronic disease and also diabetes management are also all accessible through that Personify Health. So the best first step to engage in the HealthFlex Wellbeing Program is to navigate to this website here. And that's the Personify Health enrollment page. You'll ask some questions, or you'll answer some questions. It'll ask for your social security and other key indicators for you. You'll set up your account, and then from there, you're able to use the program. As new enrollees in Personify Health, you're able to purchase this Max Buzz. So the Max Buzz is on the left-hand side here. That's actually their activity tracker. It looks a lot like an Apple Watch. It functions a lot like an Apple Watch, and actually has some neat features like it'll track your steps, it'll track your miles, it'll also track your sleep, and it'll also track your sleep, and it'll actually track your heart rate. So you could judge how hard you're working or exercising as you're out and about doing those things. So the first key thing to do is to log into or create an account at Personify Health, and then navigate, and you're able to buy that Max Buzz at no cost to you. So the first Max Buzz is free. Should you need to replace it, you can always purchase it in the store with money that you've earned in the Virgin Pulse Pro or the Personify Health program. So once you have created an account in Personify Health, we suggest to go and log in or open up your smartphone, navigate to the respective store. Like I use an Apple phone, so I went to the Apple store and then downloaded the Personify Health app. So you'll just search Personify Health, and what we see here is the logo of Personify Health, that little yellow and black swirl. It looks like a smiley face, actually. Okay. You'll log into that app using the login information that you created when you set up the account the first time. You'll need to use a smartphone, so a Samsung, a Galaxy, an iPhone, to upload your steps from your Max Buzz, Max Go. Max Go is the new activity tracking device. And then you can always log into Personify Health web-based and complete different activities. Personify Health, though, you'll find that app is very user-friendly, and they actually build the program out on app first. So they make it work on the app first, and then they bring it to the web-based platform. You can actually scan this QR code with your phone, and it'll bring you to the wespath.org incentives page, and you'll be able to review all the different programs and all the incentives. The Personify Health program acts as a hub. That's where you'll go to find coaching. That's where you'll go to find the health check. But the Personify Health program actually allows you to earn money. They call it Personify Health Cash. And essentially, you earn points for doing different activities. And when everybody begins at level 0, and then there's level 1, 2, 3, and 4, and you'll earn Personify Cash for reaching each of those levels. And I'm here to tell you that everyone can reach level 4 by the end of the quarter. There are tons and tons of ways to earn points. And then there's also valuable bonuses that they give for completing or doing things a certain number of times per month. So when you first log in and create your account, you can add a picture and earn 100 points. I don't use my picture. I actually use a picture of a Starbucks cake pop. That's my motivation for physical activity, is to be able to go eat a cake pop guilt-free. But you can add a picture, a profile picture. It doesn't have to be you. It could be, there's lots of pets, lots of dogs, lots of beaches, lots of docks, and lake pictures taken from a dock. So you can be creative there. When you're enrolled, go ahead and search for me, because you can actually earn points for connecting with friends. So there is a Facebook kind of social aspect to it, where initially when you're brand new, it'll just suggest people across the denomination that are currently enrolled in Personify Health. You can also search for your friends, and then you'll get points. You'll get up to 250 points for connecting with the first 5 friends. So a good way to propel you to that first level to earn those incentives. Another very powerful way to earn points are these daily activities. When you upload steps, so that Max Go will track your steps, you'll get 10 points for every 1,000 steps that you upload, for a maximum of 140 points per day. So if you go 140 times 90, that is a tremendous number of points. And I said 90 because this is a quarterly program. It begins the first day of each quarter and ends or resets the first day of the next quarter. So every quarter, the first day of every quarter, we start off at level 0. We upload steps. We earn points for those uploads, and then we navigate. We go up through the different levels. Another way to get daily points is to complete cards. So there's 2 cards that are offered per day. So if you missed yesterday's cards, you can't go back and complete them, but you can still complete today's cards. So the cards are basically just tips, tricks, health tips. So drink more water, maybe make your lunch at home, suggestions for making a quick lunch to save money, which would address the 5 dimensions of well-being. So those cards are things that you can put in place that day to improve your well-being. Another way to earn daily points is by logging or tracking your healthy habits. I track a lot around my sleep and my nutrition. Those are 2 areas that I'm working on. So you'll get 10 points per habit for the first 3 that you track each day. Now, habits are a little bit different. If you missed tracking yesterday's habits, you can always go back. So with the habits, you can go back in time and track those. You can go back for up to 10 days and earn those points. Where the cards, it's day of only. Your Max Go will track sleep. So all you need to do is wear the Max Go to bed. And when you wake up in the morning, you'll sync your steps to the app, and you'll sync that data to your app, and you'll get 20 points for tracking sleep. So 20 points for just wearing that Max Go to bed. And then if you've slept 7 hours or more, you'll get an additional 50 points. So if you sleep 7 hours or more in a night and you track your sleep, that's 70 points a day. 70 points a day multiplied by 90 days in a quarter. That's a very powerful way to propel yourself to the upper levels of the program.
May I have a question, please?
Sure.
So we have to use the tracking device. We cannot use our own.
You can use a compatible device, and generally
Okay.
speaking, the compatible devices are a Polar. Polar, they do heart rate monitors. So Polar, Garmin, Fitbit, and there's likely others that are compatible.
The
And
Samsung watch, would that work included?
that should be, yes,
Okay,
because what you'll do is you'll connect the Samsung Health app to your Virgin Pulse program. So when
gotcha.
you
Thank you.
then you go sync your watch to your Samsung app, and then it'll feed over to Personify Health.
Thank you.
Sure. So with that, so you can connect compatible devices to your Virgin Pulse, to your Personify Health. I might slip up and say Virgin Pulse. They changed their name this January 1st. So I'm still in the honeymoon period of calling it the right name every single time. So Personify Health is the app that you'll connect the device to. So another powerful way to earn points is by hitting those bonuses. And the bonuses are available for essentially every category. You'll get a bonus for tracking your steps 20 times. You'll get a bonus for uploading 7,000 steps 20 times in a month. You'll also get a bonus for uploading 10,000 steps in a month. The neat thing is it doesn't have to be consecutive. It's not perfection. It's if you hit 7,000 steps 20 times in a month, you'll get a bonus. If you do that with 10,000 steps, you'll get a bigger bonus. It's actually 500 points. If you sleep 7 hours or more 20 times in a month, you'll also get a 500 point bonus. So there's approximately 3,500 points available each month in bonuses. So if you're focused on tracking, let's say your steps, if you're able to hit 20 times a month tracking your steps, you can actually get that 3 times in a quarter. And because it's set up as a quarterly game. So tons of ways to earn points. If you want to see all the different ways to earn points, you can open up your Personify Health app, and then you click on rewards at the top, and then it'll look like, oh, it's not really showing. It's kind of bled out. You'll see the number of days that are left, like there's 56 days left in this quarterly game. It'll go through June 30th. And then as you scroll down, you'll see a link in blue that says learn how to earn more points. By clicking on that, you'll see a comprehensive list of earning points that's broken out based on activity, completing cards. So if you complete 10 cards in a month, 20 cards in a month, you'll earn bonuses. You'll get a bonus for joining a challenge. And then you'll also get bonuses for tracking nutrition, tracking your sleep, and also bonuses for just tracking your healthy habits. So lots of bonuses out there, 3,400 points available just in bonuses. So that would be, if you hit all the bonuses, just the bonuses, that would be about 10,000 points. So plenty of opportunities to earn points and move through those levels. Here's the incentive that's available. So you can earn up to $160 annually. That breaks out to $40 per quarter. So if you reach level 4 in a quarter, you'll have earned $40 in Personify Health Cash. And that spends just like money. The Health Cash, that incentive, that lands in your Personify Health account, and then you can transfer it out to your bank. You can use it in the store to purchase another device or a physical activity program or a physical activity device. I've chatted with participants who've saved their money up and have bought an Apple Watch. They've saved their money up and bought a Mac, a Mac Air computer. Personally, We've used it to buy a refrigerator, a new stove, and we've gone on a weekend away from the kids. So the money that you earn from Personify Health, you can earn 160 per year, 40 per quarter. In addition to the wellness points, you can earn wellness credits. The wellness credits run annually, so you could actually get started on those now. And you might have already completed some activities that give you points or give you credits. And you get credits for a variety of different activities. Completing a journey, you get credits for completing the health check. You get wellness credits for logging into Benefits Access. And as a HealthFlex plan sponsor, when you log into Benefits Access, you'll be able to get those points or those credits, and you'll just get it once, but it's I believe you get 25 or 35 wellness credits for just logging into Benefits Access. So lots of different ways to earn wellness credits. When you reach 150 wellness credits, Personify Health will put $150 into your Personify Health account. Okay, so that takes a couple of days. So as you do those activities, earn those credits, several days after you reach 150, they'll put $150 in your account. And that just spends just like cash. I talked a little bit about this earlier. The Blueprint for Wellness screening is offered through Quest. You can actually navigate to Quest in your app and register for an appointment. So there's a number of ways to complete that appointment. Some plan sponsors offer on-site screenings. Some plan sponsors just promote the other 3 ways to do it. And you'll be able to search for a local Quest facility. You'll want to make sure.
Actually, we don't have one.
You don't have a Quest facility?
I verified that with either Bob or Jody.
Okay.
So
Then
go ahead.
I'm sorry. So then you're able to, you can use the physician form, which that's another option. So you're able to download that form. You'll bring that form with you to the doctor. The doctor will run the tests and then complete the form. And then you can do one of 2 things. You can have the doctor fax the form in, or you could bring the form back home with you and then upload that into your Quest account that you access by way of Personify Health. So you open up Personify Health and then navigate to Quest, and you'll upload that just like you're uploading a picture onto an email or a text, and then you submit that.
And I just saw in the chat, I think it might have been Andy that said there is a Quest lab in Noonan. And
okay.
Yep, it was him. So he was able to complete it there.
Excellent. And just for reference, how far away is Noonan from LaGrange?
30 minutes.
Okay. So it's not totally convenient for everyone.
Right. But we do have several employees that live there.
Okay. Good. So completing that Blueprint for Wellness, you'll get $100 placed in your account. And then 3 weeks or so after you complete the screening, that My Guide to Health will arrive in the mail. You'll know that it arrived because it's a big, thick, white folder envelope. And then as you open it up, there's colorful description or colorful examples of what your test results look like. Most of them are on a speedometer, from good to maybe need some change to maybe need some more change. So green, yellow, and red. And there's a very clearly written explanation of why that test was measured and why it's important to you. The My Guide to Health will also recommend programs that are offered through HealthFlex. So basically programs back to you that could help improve that measure. And many of those are at no cost to you. Really, the only program that's out of pocket cost would be Weight Watchers. And that's at a significant reduction. So you'll only pay half of what the corporate dues are. So Wespath gets a very good deal from Weight Watchers, and it comes out to and then HealthFlex pays half of those fees. So definitely something worthwhile to look at. And then the health check, you'll complete that January through August. Really, between Blueprint for Wellness and health check, you can complete either one first. If you complete Blueprint for Wellness first, then those test results will populate health check. And then that way it's easier to complete health check. So your blood pressure, your height, your weight, all of those, your cholesterol will all populate health check. And completing health check means that you'll avoid the higher deductible for the following year. So in 2025, you have the lower deductible. To maintain the lower deductible, you'll need to complete health check between January 1 and August 31st this year. If you are married and your spouse is also covered by HealthFlex, then they also need to complete health check during that same period, January to August. And then in 26, you'll complete health check to avoid the higher deductible for 27. So this program is always working 1 year ahead. So Personify Health Coaching is a program that you will earn wellness credits for. You'll earn 25 wellness credits for each coaching call. The coaching calls are typically spread out by a week or two. Sometimes if your goals are a little bit loftier, it might be a month between calls, but you'll earn 25 points for each of those calls. So in 6 calls, you'll earn 150 wellness credits. And then, so that's an easy way to improve your health. And because these coaches are qualified, they all have a degree in exercise science, a degree in nutrition. They might have a degree in social work, in behavior change. So these are individuals that are qualified to dispense health information, well-being information, behavior modification stuff. I like to pick on Google a little bit, and Google is great, right? Because you can type in a word and get a response back. But if we type in, how do I decrease my weight? Or how do I increase my physical activity? We're likely going to get several billion hits. Mm-hmm. So where do we start, right? The personified health coaches are going to basically provide that information right off the jump, right from the very beginning, that you can that you can feel assured that the information is evidence-based, it's accurate, and it's safe, which those 3 things can't be said for just a general search on Google. I want to decrease my weight. How do I do that? You'll get, a variety of different kinds of hits. And sometimes getting that many results back is paralyzing because you don't know where to turn. With the personified health coaches, they're educated and able to provide coaching on lifestyle management, including becoming tobacco-free, improving your sleep, reducing stress, eating healthy, but then they can also help you navigate any health situations like chronic pain, digestive health, heart health, diabetes, all of those different areas they are qualified to address and qualified to help you make those changes. The scheduling is actually done through the Personify Health app. If you're not ready for a coaching session, you might want to try online journeys. And an online journey is essentially you navigate to those in the app and then you select what you want to work on. Like, let's say there's one on reducing back pain. I took that one. So that one's will suggest activities to do, stretching, posture, maybe some physical activity to help reduce that back pain. And each journey, you'll get wellness credits for completing each journey. Most of the journeys are around 10 steps or so. So once you complete that 10th step, then you'll receive those 15 wellness credits. So you could be working on a number of things at a time to earn those credits. Oh, and incidentally, I forgot, the Blueprint for Wellness results, you have the ability to earn up to 140 wellness credits just by completing your Blueprint for Wellness screening. There are 7 tests that you'll earn 20 wellness credits for each if it's in the healthy, if that result is in the healthy range. Next year, when you complete the Blueprint for Wellness, if there's been any change between this year's and next year's Blueprint for Wellness screening, any change at all, you'll get any positive change, you'll get 20 wellness credits. So this year, because there isn't a Blueprint for Wellness screening on file, you'll just get wellness credits for results that are in the American Heart Association desired range. So blood pressure less than 120/80, you'll earn a wellness credit. LDL cholesterol in the ideal range, you'll earn 20 credits. Next year, you'll get credits based on change or if they're in the healthy range. So a great way to increase, a great way to collect those wellness credits. And then with the back to the journeys, you'll get wellness credits for completing the journeys. You can get up to 45 wellness credits. So complete 3 journeys over the year. And this is just the tip of the iceberg on what is available. Reduce stress, healthy eating, reduce back pain. There's how to lift weights, how to start a walking program. So many, there's probably at least 100 different journeys out there that you can participate and earn those wellness credits. The goal for these is to allow that individual to move at their own pace with behavior change. So it's kind of like a small bite. It's an easy step to take, and then hopefully that will stay. They like to use in behavior change the term sticky. So it's sticky, so you continue to do that habit. The nutrition guide, and I'm also going to talk about the sleep guide after this. So the nutrition guide and the sleep guide, these are both quarterly programs. So when you set up your nutrition guide, you're basically just indicating what you would like to work on. And you could see here that the energized eater is yellow. That means I selected energized eater as my topic or my area to work on with nutrition. And then it'll provide 3 healthy habits in my healthy habit tracker that I can track each day and earn those points. So essentially, you go through this nutrition guide. There's only 2 steps. And then the energized eater is I eat to nourish my body so I feel energized and focused all day. I typically bounce between the energized eater and the meal planner. The meal planner helps me shop for what I want to eat that week, particularly breakfast and lunch. We eat as a family together at night, and that's more of a family thing. But this helps me focus on my snacks during the day and make sure that, and it coaches me to eat healthy. Believe it or not, the Energized Eater, it doesn't say to eat potato chips. Potato chips are my treat. But I typically bounce back and forth between Energized Eater and then Meal Planner because I found that those help me focus for me best. I would encourage you to go in and take a look at these and to do these actually, because you'll earn 250 points a quarter. So the first day of every quarter, I go in and I switch either between Energized Eater or Meal Planner, and I earn 250 points. There's also recipes available in the nutrition guide. And and this is my favorite part, is that the recipes, there are members in our program that are commenting on those recipes. And they might even provide a very useful, helpful alternative. Oh, instead of applesauce, I tried ground cranberry sauce. So a different technique to add fiber, a different technique to add flavor, and make it, visually interesting with the red color. So there are suggestions in those recipes. I'll show you where when we're done here, I'll show you where you can go navigate to those recipes. But this is a great way to earn points and a great way to add some flavor and some new recipes to your diet. The sleep guide works the same way. This involves 4 steps. You'll pick what you want to work on, and I typically pick getting to bed and keep it going, because 1 o'clock you wake up. How do I get back to bed? So I typically bounce between getting to bed and then keeping it going. So you'll go through and you'll pick what you want to work on, and then it'll add those healthy habits to your healthy habit tracker. You'll set a sleep goal. And to be honest, I set my sleep goal just at 7 hours. My goal is to get more than 7 hours each night, but I have it just at 7. And then you'll determine how you want to track your sleep. So if you use a Max Go, you'll indicate that. If you use the Samsung Health, you'll indicate that. So you'll basically determine how that data is coming in. And then as you upload your steps in the morning, it'll also upload your sleep. And then you'll get those points associated with that goal if you hit it or not. I've had nights where I've had 6 hours and 59 minutes of sleep, and I'm like, oh, just 1 more minute. I lost out on 50 points just because of a minute. But I was close. A couple other really great programs include the chronic disease prevention. This is offered through a company called Omada. This is at no cost to you. It's an online program that's designed to reduce your risk of developing chronic conditions such as diabetes or heart disease. And there's a focus on reaching a healthy weight. So it's not directly a weight loss program. That's kind of included in the curriculum though. You'll actually have a health coach that will help work with you on that. There's interactive weekly online lessons that you can complete and should complete. If you are at high engagement with the program for 9 weeks out of the 16 initial weeks, you'll receive 150 wellness credits. So if you're on track with the Omada chronic disease prevention program, over 9 weeks, you'll receive that full 150 wellness credits.
Okay.
The diabetes management program, this is a program that we actually brought on first. So we brought this program on before COVID. So it was probably March of 19, March of 18. And originally it was specifically designed to work with individuals with type 2 diabetes. Over time, they expanded their ability to work with people who have type 1 diabetes. So this diabetes management program will work with either individual. The coaching is provided by a certified diabetes care and education specialist. That's a rather difficult certification to receive or to earn. So these are high quality coaches that are going to provide this type of care. It's a diabetes focused curriculum. It's actually created by the Diabetes Prevention Program, which was a research study back in the late 90s, early 2000s. Being enrolled in this program, you'll actually receive a cellular connected blood glucose meter and a scale. For the chronic disease prevention, you'll actually receive a smart scale. So all you need to do with those smart scales is open it up, power it up. It'll connect automatically to your Bluetooth, and you're able to weigh yourself and that information, along with that connected blood glucose monitor, will go directly into your program. To determine if you're eligible for the diabetes management or the chronic disease prevention, you would just navigate to the Omada section of the Personify Health app. So navigate to Personify Health, go to benefits, and then navigate and find this. There's a short questionnaire that you'll need to complete to see if you're qualified for the program. So in some cases, you might not be qualified. Two of the easiest would be if you're pregnant or if you're under treatment for a chronic disease like cancer. Those are, in both cases, this program is best to wait until that care is completed. Another program that was enhanced over the years due to information that we received from the health check and also another clergy health survey that we do every 2 years is the EAP program. And EAP really stands for Employee Assistance Program. It was originally brought into the workplace for mental health counseling. And with the HealthFlex program, you're allowed 8 no-cost sessions per concern per year. And this is available to individuals covered by HealthFlex, but it's also extended to everyone that is living in that household. So if somebody has HealthFlex in that household, everyone in that household can use these 8 sessions. And that's 8 sessions at no cost. Should there be a need for additional care, you'd be able to transition to your behavioral health benefit in HealthFlex. To access that, you would be able to just contact that number there. They're going to give you an authorization code, and then you'll give that authorization code to the person, the professional providing that care. Really, no issue too big, no issue too small. Could be something like substance abuse or stress, anxiety, depression, conflict resolution at work. You can also find elder care or child care in your community. So my parents live in suburban Detroit. My dad needed additional care. So I've actually used that twice to provide a list of local retirement facilities that would be able to provide the care that he needs. The terrific thing about those resources they provide, they've all been vetted. They have interaction with those companies. They know that they're a quality company. So I mentioned going to Google and searching for something. I typed in my parents' zip code and just said, need elder care for my aging father. It came back with like 3 billion hits. That didn't get me any closer to making a decision, right? That actually caused a little bit more stress. I called the EAP, explained the situation, and in 3-4 business days, they provided me with three providers in the range that I had specified. And then my mom was able to go out and dad was able to go out and take a look at those locations. So the idea with that type of the elder care, child care resource and referral service, getting you to be able to make a decision quicker.
We had a question in the chat about the 8 no-cost sessions. Is that per family or per person in the family?
It would be per person, per concern. So if, let's say, not to make light of it, but you could say initially it's anxiety. And then, you could go and say, hey, now I'm having difficulty. So if it's anxiety in January and then it's sleep disorder in March, you're able to still call back in and use that resource.
Okay, so if I have my spouse and 2 children, I could have 8 no-cost sessions for all of us.
Correct.
Okay, and then if, in addition to that, if a first concern was anxiety, to your point, and then another one was, I guess this is related, but stress, then that would be another 8 sessions.
That is correct.
Okay, nice.
So MD Live, Wespath brought, and this is another example of how the programs have expanded based on what we've seen and what we've found out, what we've learned from the health check and the clergy health survey. We had MD Live as the telemedicine provider. You wake up at 2 o'clock in the morning, child's got a fever. I woke up at 2 o'clock in the morning with my eyes swollen shut, made a phone call, and by the time the pharmacy opened at 7 a.m., there was a prescription waiting there for me to pick up. So MD Live does 2 things. It does telemedicine, so it's your physician phone line. But then the second thing we added just about 3 years ago was the behavioral health. And you're able to access licensed therapists, board certified psychiatrists through MD Live. So MD Live now provides behavioral health therapy and psychiatry. It's possible that some of those appointments could take place on an evening or weekend. This would be virtual access, so it'd be just via telephone. But another wonderful resource. And living in a small town, I know clergy don't like to go to, if there's only 1 or 2 counselors in town, they're reticent to go because they might be seen, their car might be seen out front. This provides a wonderful opportunity via telephone or even video. And that could be at early morning, late at night. And those guidelines, you would come up with with an approach or a game plan with that therapist that you're working with on appointment times and access to weekends and such. But wonderful resource. The length of time that it takes to typically get in to see a psychiatrist through the health plan could be a couple of weeks. We've been told that this is a lot shorter. It could be as little as a week. So wonderful resource. You can actually scan this with your phone, and you'll also get this with the slide deck, but this will take you to an interactive resource that was put together to kind of help you land on where to start with first. So it may recommend the EAP, it may recommend MD Live. It could also recommend like a journey in the Personify Health. So those recommendations will come personalized to the input that you put in. And that's available on wespath.org now. So if you just went Wespath Mental Health Resources, if you search for that on our website, you'll land right on those resources, or that QR code will take you there. And then Weight Watchers, this is a tried and true program. A lot of individuals have had success with this. The core program is $975 a month. The premium is $1911 per month. So that's less than half of the retail costs. So definitely a good deal. The core is online only, and it provides access to all the resources, all the recipes, the tracking. The premium includes the local meetings, the local weekly meetings. And then we also have Benefit Bite videos. And if you went to wespath.org and just search Benefit Bites, you'll be able to see informational videos. They're short clips. This one talks about the health check. Unfortunately, that's also me talking about the health check. So a little double dose of Todd today. And then the key takeaways, there's something for everyone. You know, the first best step would be to enroll in Personify Health and then download that app. And then everything then is acceptable or accessible from that app. This last Super Bowl Sunday, my wife and I each forgot something at the grocery store. So we ran back Super Bowl Sunday. And as we were standing in line, my wife completed her health check. She wanted to get it done, but it's so easy that you can actually do it in line on Super Bowl Sunday. Remember, Health Check and Blueprint for Wellness have deadlines. It's August 31st for both. Completing Blueprint for Wellness first will then populate Health Check, which makes Health Check easier to complete. And all in, you're able to earn $410 per year, per calendar year in Personify Health Cash. And that spends just like money. All that will land in your Personify Health account. From there, you could transfer it to your bank account. You can use it to purchase another device or a piece of fitness equipment. You can also donate that directly to UMCOR through that donation feature. So that was something nice that they added for us a couple of years ago.
And I just want to tell you how easy that is. While you pointed out a couple of ways to earn points that I didn't know about, and since we've been on this call, I earned 480 points.
You've earned 480 points?
Uh-huh.
Woohoo! How did you do?
Updated my profile picture and went to the nutrition guide and identified a type of eater, and then looked at some of the carbs that I'd forgotten and a couple other things.
That is fabulous. And so I mentioned the cards, right? The cards, you can change the content of the cards by, if you open the app, lower right-hand corner, you'll see the ... and it says more. So if you click on that, now it opens up another menu. And what you need to open up, click on topics of interest. And then you should see 3 buckets at the top. Mine say getting active, eating healthy, and managing stress. If I click load more, then I see learning new things, purpose, belonging, blood pressure, weight management. So if you click on those topics, that will then sort cards from those topics at a higher priority. So you'll see those topics more in your cards. So what you're doing is driving content that's more interesting to you. You can adjust your cards. I think it's once a year. Actually, let me do that again. You'll get 400 points for adjusting your interests. So that is a huge reward just for changing it to meet your needs. So if you did that once a year, you'll get 400 points in that quarter that you adjusted it. So it's another great way to earn points and propel yourself through the levels.